Guys, this is Mobeen. We are continuing with our discussion about cholelithiasis. Today we'll talk about the acute cholelithiasis or flare-ups and the reasons that can, or the causes that can lead to acute cholelithiasis. So the first batch of causes are going to be around the cystic duct or about the cystic duct. So of course, in that, tumors that can be impacting on the cystic duct and blocking it would cause the bile flow to be obstructed and then cause inflammation behind the impaction, which would cause acute flare-up. That is one. Then scarring and inflammation of the bile or cystic ducts can cause acute flare-up. Then 90% of the cases of acute flare-ups are in patients who have gallstones. And what happens is that some gallstone can get impacted in cystic duct, once again blocking it and causing inflammation behind it, which would cause acute flare-up. Similarly, the stones can go and get impacted in the pylorus or the duodenum. This impaction in the duodenum can be seen as a proximal form of gallstone ileus or Bouveret Syndrome. The gastric emptying reduces, and of course the bile or cystic system also becomes inflamed, and that can cause the flare-up as well. So then the second thing is the infections. The hepatitis C in men can lead to acute flare-ups. Similarly, in patients with AIDS, cytomegalovirus, microsporidiosis, cryptosporidiosis can lead to acute flare-ups. Rapid weight loss can lead to acute flare-ups. This is why the experts say that you should not, if you are going to start reducing weight, do not reduce more than 2 to 3 pounds per week or more than 5 to 10% of the body weight in 6 months. However, if bariatric surgery is needed, if it is indicated that the weight loss has to be rapid because of other reasons, then Ursodiol can be used, which would help prevent the formation of stones or that micro sludge and help prevent with the acute flare-ups. Then the vascular diseases, vasculitis, polyarteritis nodosa, and Henoch-Schönlein purpura or HSP can lead to acute flare-ups as well. And finally, if there is a patient who had a major surgery and then 2 to 4 weeks after develops fever and or upper right quadrant pain, suspect acalculous cholecystitis, meaning cholecystitis or acute flare-up without a stone. Similarly, a patient who has been on feeding without the oral intake can develop that microlithiasis or the sludge in the bile system, which can cause acute flare-ups as well. Such patients who are kind of on a fast for a longer time, when you rehydrate them and when you provide them nutrition, they can actually come out of that state without forming the stones. So these are some important causes of acute flare-ups or acute cholelithiasis. Talk to you later. Bye.